So welcome to the first Hemophilia Council of California webinar for 2023. I'm Lynne Kinst. I'm the Executive Director of the Hemophilia Council of California. And we want to thank you for joining us this evening. And I'm going to just briefly acknowledge our sponsors that help make this webinar possible. So just briefly, for those that might be new to the Hemophilia Council this year, as this is the start of a new year, just a quick introduction, but our focus at the Hemophilia Council is really to coordinate statewide access and education and advocacy efforts on behalf of individuals living with bleeding disorders. And in that work, we partner with many of our other rare and chronic disease community partners. Our mission is to improve access to care and treatment options in order to advance the quality of life for people living with bleeding disorders through advocacy, education, and outreach in collaboration with our founding member organizations. So, but without taking any more time, we're going to get into the meat of our presentation. And I know that probably some of you today are excited to join in order to meet our new legislative advocate. So, as many of you know, Terry Calgar-Hill had been the legislative advocate for the Hemophilia Council for many years, and she has transitioned and just made some reductions in her client load. And so we are thrilled to introduce Cher Gonzalez, who is our new legislative advocate. She's the principal with Resolute Company and has been a health policy expert and advocate in the Sacramento region for a number of years, comes to us with some great experience and is someone that we have worked with on other issues in the past. And Cher, I will let you take it over and tell a little bit more about yourself.
Hi, everyone. It's so nice. Some of you I've met before. We're excited to start representing you as of 1/1/23. I've been a longtime admirer of HCC and everything HCC does for people living with bleeding disorders. I'm a patient advocate for other patient advocacy organizations. So I represent the American Diabetes Association, also the California Chronic Care Coalition. And so patient advocacy is something near and dear to my heart, and I aim to give you the best representation I possibly can. I've been in politics for over 20 years. I don't even want to say anymore because it gives away my age since, I'm only 26, right? But it was my first job out of law school. In fact, it was one of my jobs while I was in law school as well. So I've been in politics ever since the very beginning of my career. And I look forward to bringing you guys along the journey, everything legislative and regulatory, and being a great guide while I support Lynn and everything that she does for you guys.
Thanks, Cher, for that introduction. Like I said, we're thrilled to have you on board. So I'm going to let you keep rolling, and we're going to jump right into some updates in terms of the state budget and legislative advocacy for this year.
Perfect. So the budget this year is not so great. We have a $22.5 billion shortfall. Now, normally that would be really, really bad news, but we do have billions in reserves. So it's not as bad as it could be. It's not as great as it could be either. So in past, when we had really great budget surpluses year after year, you would read the budget very excitedly to see what new funding did we get in this program and this program, and that's not the budget that we got this year. On the other hand, it's also not like the budget shortfall, budget deficit years of past either, because generally you would read the budget very shakily and very nervously, right? Because there were going to be cuts after cuts and after cuts. And oh gosh, don't let those cuts happen to us. And that didn't happen either because of those billions in budget reserves. So what did the governor decide to do with that $22.5 billion shortfall? He decided, well, what we're going to do is we're going to delay a lot of the funding that was passed in last year's budget for new programs, and we're simply going to delay funding those new programs. And that is how he's trying to address the budget shortfall so far. We'll know a lot more when the April tax receipts come in, and then we have what's called the May revision, where the governor revises his budget proposal of January based on those tax receipts. And in the May revision, we'll have a clearer understanding. Did things turn around? Are they worse than what we were thinking they were going to be? Are they going to be better than we thought? Even if it's bad, the governor would like to just address the budget shortfall by delaying spending for the new programs that were passed last year, mainly in the area of climate action. And then if that doesn't do the trick, then utilizing budget reserves. He's really going to try and not make cuts to programs. So cross your fingers that things don't turn out as bad as it could be in May, and we will hopefully avoid any major cuts to programs. Right now, as of where we stand right now, the governor is not projecting that we will have a recession. And even he uses the term mild recession in his budget. So cross your fingers that we don't go into recession, because that's really going to be a big part of whether we see steep cuts in the future, is if we nosedive into a recession. Lynn, you want me to start talking about specific spending proposals that we have? Okay.
Yeah, that'd be great.
So again, it's not a very exciting budget where we can look at like, oh, all these new programs are going to be funded. It wasn't a lot of that. But there were some things that I could pull out that you guys might find interesting. One was the California's Behavioral Health Community-Based Continuum Demonstration. Wow. Try to say that 3 times fast, right? I had a hard time when I was reading it, but it's $6.1 billion over 5 years between DHCS, the Department of Healthcare Services, which oversees the Medi-Cal program, and the Department of Social Services. And it's really going to try and fund these continuum programs to target at-risk youth, homelessness, people with emotional disturbances and substance abuse problems, and serious mental illness, and then justice involved youth. And the whole point of this is to try and provide that continuum of care for behavioral and emotional health that we haven't really seen the state do a very good job of in the past. And so that's what that project is going to be. So there is significant funding for that project, which is very good news. There's going to be funding from the opioid settlement funds for opioid and fentanyl response, where they're going to take like $93 million and do it in a variety of ways to try and combat the opioid and fentanyl epidemic that we're experiencing. And then there's a very exciting project that we don't know anything about. The governor is not giving any sort of details, but it's called the Health and Human Services Innovation Accelerator Initiative. And we don't know how much they're going to be spending on it. The governor says that we'll know more about this program in the coming months, and definitely by the May revise. But essentially, it would be a new entity within state government with seed funding, in which California is going to be looking at the greatest, and I put greatest in quotation marks because these are the governor's budget proposal words, the greatest threats, the greatest health challenges that threaten Californians today. And so one of those is, for example, diabetes epidemic in California. There were a number of others like senior health. There were a number of others that they mentioned could possibly be part of this program. Don't know much more about it than that, but I'm excited to learn more details, because we could obviously advocate for the governor to include rare diseases as part of that accelerator program, right? So that could be something that we could do as HCC. A few more things, home and community-based service spending plan. I know that's something that is important to many people within HCC. There was a number of proposals last year in the budget, in the 2021 Budget Act, that made funding from the American Rescue Plan available into 26 initiatives across 6 HHS departments within California. So that could be like Department of Public Health, Department of Aging, Department of Healthcare Services. And the budget unfortunately includes a $60 million reduction to the previous budget funding for that. But there's hope that perhaps that the legislature will not entertain this $60 million reduction in funding and maybe pushes for just a delay in funding. But that program, which was so exciting to help people stay in their homes and have community-based services, that has a $60 million proposed reduction in funding. So we'll be keeping an eye on that. And then of course, there's also funding towards the SMARTER plan, which is the governor's COVID response, although the governor does indicate in his budget, because of the public health emergency winding down, that there will not be the previous amount, the previous volume of spending on COVID-19 response in the future as there has been in the past. But he still reflects $176 million in COVID-19 response.
So these are some issues that are not necessarily, they have budget implications and are things that have been introduced in past budgets, or they are sort of ongoing policy issues that we wanted to mention that will be critical this coming year. So many of you may already be familiar with Medi-Cal Rx. That is a governor's proposal that kicked off. Really, there were a number of delays in implementing it. So it really began at the beginning of this past calendar year, so January of 2022. And essentially that was a move to take all pharmacy benefits, so all prescription drugs from Medi-Cal managed care to a fee-for-service way of reimbursing or paying for the medications that you take. So for those that may not be familiar with what all of those terms necessarily mean, essentially what that meant is that it used to be a lot of folks that are on Medi-Cal have a managed care plan that is covering them. So they might be on Medi-Cal, but they might have, Health Net or Blue Cross, for example. And that insurance company would take care of the prescription. Now all prescriptions are handled directly through this Medi-Cal Rx. And frankly, there were a lot of hiccups at the beginning of the year. There were delays, there were just problems with the implementation. And so that is something that we have been watching very closely, because obviously for the bleeding disorders community and other rare and chronic disease communities, access to our medication in a timely manner is a very critical, a really critical matter. And so the state created something called the Clinical Liaison Team, which was specifically assigned to help our, to kind of monitor and help our most vulnerable patient populations, including people with bleeding disorders. And that really helped to smooth out a lot of the issues that we were seeing. But there continued to be changes and adaptations to that program. And so while sort of towards the end of the year, it was going pretty smoothly, we will continue to monitor that very closely. CalAIM is another initiative that falls under Medi-Cal, and it is a series of initiatives which are about trying to ensure that Medi-Cal services are really more robust, and that they are excuse me, more of a whole person kind of care, which for us in the bleeding disorders community, that is, that's a concept that we're very familiar with, right? We often, our patients are seen at hemophilia treatment centers by a team of providers that's really looking to address the whole person and make sure that everything is being taken care of. but that isn't actually very typical of the US healthcare system, right? Like outside of an HCC, most of us, it's like you go to one doctor for this, and then you have to get a referral to another place, and it's very scattered and disconnected. And so at its core, it's an initiative to try to do that, to try to make that care more connected. But it also, and this relates as I transition sort of to the next part, it also is really a vehicle in which more patients are being moved into managed care plans. And as, again, rare disease and chronic disease patients, that is a little bit concerning because sometimes the managed care model can be too one size fits all for our rare disease patients or our more complex patients. And so this expansion of Medi-Cal managed care, and particularly an initiative that would expand managed care for our California Children's Services patients, so that's our CCS program. There's movement there to try to put more of those children into managed care, and that again is something that we're really working to monitor very closely and either slow that progress and progression into managed care, and or as that transition happens, really ensure that the right protections are in place to make sure that patients continue to get everything that they need. And then I also put access to new therapies on this slide because, as some of you or many of you may be aware, in November of this past year, the very first gene therapy for hemophilia was FDA approved. So that is a product for hemophilia B. And while it's not our role to advocate for specific products or for patients using specific products, we believe that that's a decision between you as the patient and your provider. We do believe that patients should have access to all FDA approved therapies. And so now that we have an FDA approved therapy, we will be working to see how the state decides to treat that and what that process is going to look like in order to have access to that new therapy. And again, any other new therapies. Gene therapy is not the only type of new therapy that is coming on the market to help patients with bleeding disorders. So regardless of what the therapies are, we want to ensure that patients have access to any FDA-approved therapy that they and their doctor together decide is the best treatment for them. Okay, so that moves us into kind of a related topic, and that is something that we have done some previous webinars about, and many of you may already be familiar with this topic, but so I'm not going to spend a lot of time explaining it because we have some other things to get to. But the Hemophilia Council of California is taking a leadership role as one of the organizational sponsors of an initiative called the All Copays Count in California. And the work that we're doing on this is to ensure that when you make a co-payment for your medication, for your blood factor, for any sort of pharmacy type of benefit, that co-payment counts regardless towards your deductible and your out-of-pocket, regardless of the source of those funds. So if it's from a copay assistance program, whether that's via a pharmaceutical manufacturer or a private charitable entity, or even, your grandmother or your aunt gives you funds to help pay for your medication, regardless of where the funds come from, we believe that should count towards those out-of-pocket costs. And unfortunately, there's been an increasing number of insurance companies that have been initiating policies called the copay accumulator adjusters, where they accept those funds to be paid for your medications, but then they don't apply it to your deductible or your out-of-pocket expenses. And so we are working with a coalition of folks over I think over 70 patient and provider associations and groups have already signed on to be part of this coalition to introduce legislation this year to help with that issue. We do have a petition that you can sign to just show your general support for the initiative and the policy. And we really want to encourage folks two ways that you can really get involved and help. One, if you have ever experienced this or a friend has experienced this, we need your story. We need patients to come forward and be willing to share their stories if they have experience using copay assistance and then not having it count, and they show up. And maybe you don't even fully understand that that's what happens, but if there's any case where you utilize copay assistance to be able to get your pharmacy, like your blood factor, for example, and then you went back later within that same year and they said, oh, you owe all this money now, that would be an example of most likely an accumulator. So that's a big issue, and we would love your help with sharing those stories, and the link is in the chat now. So we just want folks to keep in mind that any of the budget items or bill proposals that we talk about at this point, it's all very early in the process. Lots of details get negotiated, and so nothing, either good or bad, is a done deal yet. And so that's why your voice is so important. And I'm not going to spend too long and go through all of this on the slide, but we just do want to remind folks that we do have the Genetically Handicapped Persons Program and the California Children's Services in California. Those are two excellent programs to assist people with bleeding disorders who need access to insurance, basically like insurance. And we also have Covered California in here, and that enrollment deadline for Covered California is January 31st. So if that is a way that you get insurance, or if you still need insurance, please get on that right away and get your application in. And we have a lot of resources on our website on these topics, and as well as our YouTube channel from past presentations we've done on GHPP and CCS and Medi-Cal. I also wanted to touch on the fact that, Cher mentioned this a little bit in some of the budget presentation. California is really trying to expand our mental and behavioral health resources. You do have access to those programs through Medi-Cal, CCS, and GHPP. We know that at times it is challenging to find a provider, even though in theory you have coverage for it. And so we have resources available that can help you with that if you want to reach out to us individually about any of those issues. And then we are also working on an initiative this year with a coalition that started on the East Coast, the United States, that's working to ensure that bleeding disorders patients have access to either inpatient substance abuse treatment facilities and or inpatient mental health treatment. Unfortunately, there are cases of folks who have bleeding disorders being denied placement in these types of facilities because the facility is unsure how to handle the bleeding disorder. And so we're working with this coalition to help address that issue. And again, if you have a story or a developing situation, we would really appreciate if you reached out and let us know more so that we can help. So these are just some of our accomplishments from this past year. HCC sponsored the Bleeding Disorders Awareness Month resolution. We worked on a number of bills and also expansion of Medi-Cal coverage for GHPP and CCS, and launched our Advocacy and Access Ambassadors program. And this coming year, we have a lot of initiatives, as we mentioned, and Andrea threw it in the chat. We have Legislative Day and Future Leaders coming up. We would greatly encourage folks to sign up and be part of that. And we'll just have ongoing webinars and other opportunities to engage in advocacy. So we appreciate you guys being on our mailing list, getting those emails, and joining us whenever you can. We've already kind of touched on this, our priorities for this year, and they're similar across, across the years really, but our priorities are always to protect access to benefits like Medi-Cal, CCS, and GHPP, and to make sure that those are working smoothly on behalf of all of our patients. And then we're working on the All Copays Count initiative this year, And again, we will pursue having a Bleeding Disorders Awareness Month resolution, in March. And it's kind of exciting because we're actually doing Legislative Day in March this year. So we'll be able to sort of talk about how it's Bleeding Disorders Awareness Month while we're there. So we do have more webinars upcoming. The next couple of them are going to continue on this theme of helping equip folks how to share their stories, and also continuing to be briefed on, legislative and public policy matters happening here in California. So we are just about at time, and I want to give folks a chance to ask their questions. Oops, sorry, I was going to sort of briefly go through. We want to thank Takeda, which is our platinum sponsor, and then we also have Sanofi, the Hemophilia Alliance, BioMarin, AbbVie, Novo. I think I got everyone who are bronze sponsors this year, and I'm sure there'll be more coming on as we kind of get through the year here. So now's a great time for questions. If anyone wants to unmute and ask a question. I do think I saw one that popped in the chat. So you don't have to be a California resident to sign the petition, no, although it's mainly going to California legislators. So that's probably the most applicable. But if you just want to be kept up to date on this issue, it's great. If you sign that petition, then we know that you're interested in this topic. Excuse me. And I will also say on that topic that there is a national initiative that last year it was the Help Copays Act that was introduced on this topic at the federal level, and we anticipate that there will be federal legislation again this year. So if you are out of state, this still does apply to you, and appreciate you being involved and staying informed on the national initiative as well. So any questions or comments? Not seeing any hands raised, I don't think, or any other questions in the comments. So thank you all for joining us this evening. Like we mentioned, our next webinar will be coming up in February, on February 28th, and we will be talking more about how to share your story and how to be an advocate. And remember, advocacy doesn't just apply to talking to legislators. It might be advocating, at your child's school. It might be advocating to your doctor. It might be advocating to your employer. So it's a great skill to develop across many, many places. So we hope that you will join us for that. And thank you guys all for being here this evening. Good night. Thanks, Cher.
Thank you.
I got a question sent directly to me asking if HCC or NHF collaborates with the National Blood Clotting Disorders. So I do think that NHF is doing some collaboration across sort of like hemostasis and thrombosis, right? Which is broader than just, I don't know, to what degree these are technical terms, I'm not entirely sure, but we sort of refer to bleeding disorders as kind of the blanket that we use, that most patient advocacy groups use to talk about essentially like hemophilia, von Willebrand's, and similar rare clotting disorder, blood clotting disorders. And so there is collaboration there. And then there's additional collaboration with groups that are sort of in a similar space with like ITP and sickle cell, for example, because many of the providers are the same. So I don't know if that answers your question. I'll put my email in the chat for the person who asked that. And if you need to have more, want to follow up, if I didn't actually answer your question and you want to follow up, feel free to shoot me an email. All right, thanks, everyone. I will leave that there for a minute, just in case the person needs time to copy and paste before I wrap things up, but I hope you all have a great evening.